Hello and good evening, everybody. Greetings from the Leprosy Mission Trust India. It's absolutely a pleasure to have each one of you, and thank you so much for taking out your precious time on a Sunday, and that too in the afternoon. But we're very, very happy that all of you have joined in. In the last 2 years, we've seen the challenges of leprosy and other entities, how they've impacted world over. And although COVID-19 has created a few problems, its impact has been layered and multidimensional. We think it's important to understand the perspectives globally and the challenges that everybody has faced and the way forward. We're so happy to have a very, very special panelist today. We have an amazing line of panelists across the globe. And our first session is the keynote session, and I would like to welcome Dr. Anil Kumar, the DG, to join us in this first panel, and Dr. Premal Das, who is the Executive Director of the Leprosy Mission Trust India, to chair the first session. Thank you so much.
Nikita. Thank you. Thank you and welcome to all of you on this World Leprosy Day. Especially thank you, Dr. Anil Kumar, DDG, for giving us this time. Thank you, sir. I've had the pleasure of reading the entire COVID impact report from Subhajit. It's very emotional for me, and even had tears in my eyes when I read it. So while the media reported extensively on the migrants and the frontline workers, it is fitting to bring out the plight of the leprosy affected in this World Leprosy Day. While the government ensured there was adequate MDT available, access was restricted due to the pandemic and the lockdown, of course. It broke my heart when you sit in the OPD and see a patient tell me that he sold his cow so that he could pay the exorbitant taxi fare to come and pick up his medicine or to show his ulcer because his family members were not willing to keep him in the house because his ulcer had maggots and was smelling. Patients, I think, got ulcers much more, were worse since local health services health services were occupied with the pandemic emergency. Deformity and detection services, of course, were deferred with its own impact. So thank you, Subhajit and Nikita, for documenting the repercussions and of what the pandemic has done for the leprosy effect. So thank you and welcome, Dr. Anil Kumar.
Should I speak or?
Yes, sir.
Okay,
yes, sir, please.
Okay, thank you, Dr. Premal, for introductory remarks. No, in fact, as you very rightly said, that COVID created a lot of problems, especially for the leprosy affected persons. I know I'm getting so many videos and photographs on WhatsApp, how our field staff is supporting leprosy affected person, how they are delivering MDT at their home. And I know the efforts made by the healthcare delivery system to provide MDT those who migrated during COVID. So all that is there. In fact, I was in another webinar in the morning, and I was making a presentation. After 2016, under National Leprosy Eradication Program, number of initiatives taken, more than a dozen initiatives. Now we are getting, dividend of those initiatives. Our all indicators are at all-time best. Our grade 2 disability due to leprosy is going down. We have prevented some more than 30,000 disabilities during last 6 years. Now I was seeing the data from other countries also, comparing data from rest of the world with India. And what I have seen, although we are getting 57% of cases from India, but our grade 2 disability was only 26% that was in 2019. 2020, when we had pandemic, our grade 2, our case percentage, active case detected, that percentage has gone down to 51%, and our percentage of grade 2 disability has gone down to 22% in the world. So although it is reported that we are having the highest number of cases, 57%, but if you compare grade 2 disability, and that is a better indicator to compare, because if you are doing good work, you detect more and more cases and you treat them early. So 22% grade 2 disability in the year 2020. That is probably is the right indicator to present, and I think we are doing better than rest of the countries like Brazil, Indonesia in the field of national leprosy eradication and control efforts. So how we are moving forward? I talked about the staff supporting during COVID-19 time, but also we have other support we got in last 2-3 years, and I must talk about that. We have the Rashtriya Bal Swasthya Karyakram, we have Rashtriya Kishore Swasthya Karyakram, and we have Ayushman under Ayushman Bharat, we have the Health and Wellness Center, which is maybe more than 76,000 in the country now, and we have a system of community-based assessment checklist, and through that also, through all these efforts, I mean, why I'm naming all these three, because through these also we are detecting cases. We are collaborating with them, and they are doing all other work and also detecting leprosy cases. So this is how we try to maintain the tempo in leprosy case detection effort. Of course, after COVID is over, we will have to make more efforts, and we'll have to detect more and more cases. So, but the fact of the matter is, now we can have a look and we can see that in near future, I'm talking of near future means 10 years time or like that, India will be leprosy free. Now, leprosy free not necessarily mean zero case after that. We can only talk about the zero transmission. As we know, leprosy has long incubation period. So, and it may extend up to 20 years. So we need to achieve zero transmission first, and then we have to identify areas of high risk where we will be having very high quality surveillance, and that will continue for a long time, and then probably we will achieve one day that no leprosy at all in the country. I mean, the eradication of leprosy, we can think of that also. So these are the efforts. And in addition, we have to, whatever activities we are having, especially in disability prevention, DPMR activities, disability prevention and medical rehabilitation. We have to, strengthen those activities. We have to bring down the backlog for reconstructive surgery to zero level. And also we have to ensure that those who are having, affected by leprosy, they have high quality of life, and we have planned for that also. So with this, all these things, the Government of India, Ministry of Health and Family Welfare is doing, working really hard to support leprosy affected people to, make India leprosy free. And we will definitely be, the way we are moving forward, we will definitely be successful. Thank you very much.
Thank you, Dr. Anil Kumar, for apprising us of the initiatives that the Ministry of Health and Family Welfare are taking. I think that explains the reduction in the group 2 disability cases, grade 2 disability cases that you are referring to. Thank you so much for apprising us. Thank you, Dr. Premal, for your kind words on the COVID impact report. I'll just take a few minutes to take the audience through some of the learnings, some of the lessons from the report that came our way while we were doing it. Before I talk about the report in details, I should talk about how did this report happen. So if you all remember, in the last summer, in the summer of 2021, there was a huge piling up of cases of COVID. The number of cases across the world was going through the roof. There was a huge concern about the high positivity rate, and understandably so, COVID was capturing the entire mind space of all the sectors of the world. Now, but we, as an organization, as a Leprosy Mission Trust organization, which is operating across 10 states through its hospitals, through its training centers and its community projects, we realize that these numbers are not explaining the layered challenges. These numbers are masking something that is vital. It is indeed, the data itself is suggestive of the quantum of the challenge, but it is not, maybe not focusing on the layers of the challenge, especially for people affected by leprosy and other disabilities. That is when we realize that we as an organization, we need to come up with qualitative report that talks about not just the data, but it humanizes the data, it humanizes the problem and brings people's problems at the center stage, so that the impact that they have is not just restricted to positivity rate or numbers. And it gets, the purpose is primarily is to understand better, go deep into the problems and challenges, so that we can be the interface between the problem, the solution, problem and the solution, and suggest some innovative ways or pathways to move forward. Now, we started with the capital city of Delhi, where we are headquartered at. And when we went to this Tahirpur colony, which is perhaps one of the largest colonies in Asia, we started talking to people just to understand what has been their experience, what has been their difficulty in terms of accessing treatment. And we got talking to this gentleman on the left, Pramod. He is one of the experts of ulcer care at the Samarpan Foundation Trust. And he told me very, very categorically that there has been a huge, at least a 50% dip in the number of people who are coming to us for ulcer care. Now, I asked him, so what happened to them? So if they're not coming, so he told me that it is because of the restrictions in mobility. It could be other reasons, that they're not stepping out of their house. And that explains why there is a dip in the number of people who are coming for ulcer care. And those who are not aware, ulcer care is one of the most important interventions in leprosy care, which can prevent disability. So then I asked him what happened to those people who couldn't turn up at the center. He said, I don't know. I have no idea where they went. But maybe we know where they went, maybe, and what happened to them. Some few hundred kilometers east of Delhi, slightly down south, we enter Uttar Pradesh, which is quite a large state, and I think one of the leprosy endemic states in the country. And when we started talking to our hospitals, when we started talking to our medical superintendents and staff at our hospitals, we realized that this is what it is happening for some people. The lady on the left, she's a 73-year-old leprosy patient. She got an ulcer in the early 2021, just around March, late March or early April. That's when the lockdown happened and the cases surged. And she couldn't step out of her home for almost 3-4 months, until in late August or early September, the situation went out of control and the wound got exacerbated, aggravated, and she had no other option, and the doctors had no other option but to do a below-knee amputation. It is just because of the delay, it is just because of she couldn't come to the facility on time, that she had to do away with one of her limbs. And then we started to talk among our hospital staff to understand what it is that they're seeing in the end of 2021 after the lockdown was eased. What is the scenario that they face? We had long calls with them, and we realized that some patterns are emerging in the way they are expecting, and the way they see number of patients turning up at the OPDs. And they're also seeing that they're not just turning up with reactions and neuritis, but there are patients who are coming up with more aggravated wounds, which certainly points to one thing, which is the delay that happened, and because of which there is such a backlog of cases that we are seeing more and more. Now, if we correlate this backlog of cases with the secondary research that we did to see what is happening in other states of the country, we are only in 10 states. What is happening in other states? Is the situation similar to what we are seeing? And then we did some of the research. We sifted through quite a bit of media reports, and then we realized that this partly explains the backlog, and that is the number of newly diagnosed patients globally reduced by up to 70% in 2020 as opposed to 2019. But if you look at some states of India, the statistics is little more sobering, if I may say so. If, for example, in 4 states, Andhra Pradesh, Orissa, Bihar, and Madhya Pradesh, we see a 62% dip in the diagnosis of the number of patients who were diagnosed. That partly explains, and it is even more, as you see in the other state, it's almost 80% that you see. So this partly explains that, one, it is not getting diagnosed. It's because of the restrictions, mobility restrictions. Maybe the healthcare centers are becoming out of bounds for them. Most of the hospitals were grappling with the challenge of absorbing COVID patients. These are essential. Treating COVID patients was essential. That was something that was a COVID response strategy. But in that COVID response strategy, that is one of the fallouts that we could see from those reports that we came across. Now, it is so while we say that these people were not being able to access healthcare facilities, or some of the screening activities were not were either stopped or scaled down, but still there were systems in place which were working. And these systems, one of the important crucial systems, are the ASHA workers. For those who don't know, they are the accredited social health activists. They are primarily the interface between the communities and the government. They are the ones who are the first. They are primarily people within the communities, and these people facilitate healthcare facilities, facilitate healthcare treatment, access to treatment, care. And they are the ears and eyes of the government, and they are the first point of contact for a villager for getting treatment. Now, these ASHA workers had to face twofold challenge. One is they saw a huge amount of scare and fear among people who were not ready to come out in the open and get themselves screened. And the second is they themselves were a little scared because they didn't know, because there was a lot of confusion about how COVID transmission happens, what would be, how virile, how the virality of the virus, how strong the virus is. And they themselves were a little scared of their own health. So these are the issues that those numbers would not tell you. These are the issues that would emerge when you talk to them and when you understand that why is it that they're not being able to dispense their responsibilities the way they should have been. And after going through these facts, after collecting those facts, we decided to look inward and see what is it that we are doing to mitigate this challenge. And thankfully, one of our projects has been reaching out to the hard to reach areas through this mobile therapy clinic. This is in a layman, I'm a layman, and as a layman's term, I would say it's a mini hospital squeezed into a van with the provision for physiotherapy, occupational therapy, ulcer care. It can do ophthalmological procedure checkups, provide assistive aids. So when people are not able to step out of their house because of the restrictions and all, we decided to go towards them. And like many other organizations, I'm sure they have done, we also depended a lot on video conferencing, video calls, consultations, and teleconsultations. Also, in the fag end of 2021, we were really, really grateful to most of the state governments, because it is because of their effort, especially the Maharashtra government, we must acknowledge the effort, that they took the pain of identifying people affected by leprosy who had clawed hands, who had foot drop issues, who urgently needed these reconstructive surgeries to become functional again, to become functionally independent again. And it is these stories of the collaboration between a healthcare organization and the government that gives us hope that yes, if the government is there to listen to our appeals, they're able to facilitate these many people in the time of distress, that we can work together and move ahead on that direction. Now, I must also admit that one of the limitations of our report is that we have not been able to delve very deep into the livelihood issues. We were not able to peel off the different layers of the issues. But I would also say that we did more than just scratching the surface. We did an online interview. We did a telephonic interview with 180 young professionals. And mind you, these professionals have already had their share of hard times. These professionals are mostly people from leprosy and disability backgrounds. They have had their share of long drawn treatment. They have had their share of depressions. They have had their moments of stigma, discrimination, and it has taken a lot of toil from organizations like us to convince them, to encourage them and motivate them, to upskill them, to skill them and get vocational training so that they can get placed in a respectable jobs. They are marginalized not just by disease or disability, but because of the poverty also. So we have been pursuing them, encouraging them, and getting them trained in our own vocational training centers. And just when they got a job in 2020, I met a lot of people. We met a lot of people and talked to a lot of young professionals who got a job in 2020 and then suffered a job loss or pay cut immediately 1 year. So just when they were seeing the lights from the crevices, from the cracks, it's not just a job loss. It's not just as you see the 22% people that the pie chart shows, that 22% people suffered pay cut and job loss. It's not just the 22%. Job loss immediately means it's a kind of a loss of face in the community. It's job loss means that you are again being questioned, your ability is again being questioned in the community. You again feel crestfallen. You feel that you are again being sucked into the same problems from which you were trying to overcome. You know, you start feeling like a burden on the family, because you are no more contributing to the financial health of the family. So it just, at the cost of repeating myself, I would say we should not interpret this as just 22%. We should think about it is the repercussions, the ripples that it creates in the mind of those people. And we also looked at what our partner organizations, what different think tanks have been talking about the livelihood issues. So we realized that it is the job loss leads to reverse migration. It is leading to less consumption of food. More importantly, consumption of nutritious food, which again leads to low immunity, which again leads to high susceptibility of people for leprosy and other entities. And then And it also, as Arman Ali, he is the executive director of NCPEDP, he mentioned that it is also a emotional cost. The cost of unemployment has a it's very emotional to those people who have lost their jobs. On the education front, I must say that what you see on the left, it's all a result of a survey that we did with some of the students. They're all largely from leprosy and disability backgrounds. What you see here on the left is 10%. It might not come across a large share of the pie, but it still gives you that niggling feeling of that the concern is lurking somewhere there, where they're forced. They were somewhat feeling the heat at home. They were feeling the pressure to quit education. And a large 55% out of that, almost 280 students, they said that they expressed concern about the food security in their household. Now, we all feel that recommendations is always a work in progress. We can always improve on those recommendations, and we can always evolve better and effective recommendations. But if you remember the story of Pramod, which I told you in the beginning, in the first slide, the person who is an ulcer care expert and who witnessed a huge dip in the number of people coming for treatment. He told me, when I asked him, so you are telling me the problem, Pramod, now tell me what's the solution, what should we do? So his response was, why can't we have leprosy care facilities in every mohalla clinic in Delhi? For those who don't understand what mohalla clinic is, it roughly translates into neighborhood clinics, which is the first point of contact for people. You can call it a primary healthcare center for people living in urban slums and informal settlements. So Pramod's first answer was, why can't we have leprosy care services available, or ulcer care services available in mohalla clinics? Why can't we have trained experts in those clinics? What he meant in broadly is that, why can't we decentralize the points of care? Why can't we decentralize the points of care? Similarly, there were other recommendations on why we must not think of silos when it comes to dispensing MDT drugs. If, for example, right now, a person who is registered with a particular health center would get MDT on that particular health center. So now we are talking about making things more interoperable, making things more malleable for others, breaking those silos and make it a lot more fluid, so that people can be a lot more flexible and mobile and get their drugs irrespective of pandemic, irrespective of lockdowns. Even in terms of livelihoods and education, there are a couple of recommendations, but I would sincerely hope that in the coming panel discussion, we would come up with some even better recommendations than what we have proposed. And with that, I would move on to our next session, which is the panel discussion. And I'm now stopping my screen here. So you have all heard a bit of a perspective from India, and now I'm really honored and privileged to tell you that I have a hugely esteemed panel with me, with whom I'm going to discuss and try to understand and learn from them a global perspective on the impact of COVID on leprosy, NTDs, and disabilities. So I'll first introduce the panelists. So I have with me Professor Deirdre Hollingsworth. She's a professor at Big Data Institute, University of Oxford. Thank you, Professor, for joining in. We have then Dr. Nanri Takahiro. He is the Executive Director of the Sasakawa Health Foundation. Welcome, Dr. Takahiro. So Professor Deodra and Dr. Takahiro are joined by Dr. Joy Shuibu. She is a director, programs and operations, Sightsavers, Nigeria. Thank you for joining, Dr. Joy. We also have Amar Timal Sena. He is the executive director of IDEA Nepal. And they're all joined by Linda Hummel. She is the CEO of NLR International. Thank you once again, Linda, for joining in. And although we were supposed to have Aman Ali, the executive director, NCPEDP, as one of the panelists, but unfortunately he is not keeping well. But we are glad that Dr. Shruti Mohapatra has kindly agreed to our request, and she is going to give us a perspective from the disability front. She is the director, she's the CEO of Swabhiman and a disability rights activist. And with that, I welcome everybody to this panel discussion. It's really a huge privilege for me. And to begin with, I would start with Professor Deodra. Professor, I was reading a bit about the NTD Modeling Consortium, and there I realized that it has come up with certain predictions, it has come up with certain statistical analysis on what could be the impact of delays in terms of NTD programs in the coming future. Can I request you to brief us about what do those models suggest? How optimistic or how ominous are the signs?
Sure, and thank you very much for the invitation to be in such an esteemed group. Thank you very much. And I should upfront say I'm not a leprosy expert. I'm an NTD modeler in general, so please correct me if I say anything incorrect about leprosy. But at the moment, mathematical modelling for neglected tropical diseases is trying to estimate what the impact of COVID is. But as with leprosy, the information of the actual impact is only now coming in. So the models were being used to kind of project what might happen. And as we've heard today, the impact on individuals of delayed diagnosis is very severe. But also the thing that we think more about is about transmission dynamics. So what are we missing in terms of preventable onward transmission of these diseases, and in particular for leprosy? Transmission happens at a very slow rate for leprosy, so we hope we're not missing too many new transmissions. But there are likely to be transmissions that have happened in the last 2 years that wouldn't have happened had the COVID pandemic not struck. And the other particular challenge for diseases like leprosy, and it's the same to some extent for visceral leishmaniasis, which we have worked on a bit more in our consortium, is that diagnosis is also surveillance. And so we're sort of flying blind for these kinds of diseases. We can't see how much infection there is that has been missed. And we know for leprosy, there's already a backlog. And so that means what does the future hold? So as your report highlights, and also as Dr. Kumar was saying, once you start to be able to look for these cases, you're likely to find a lot more than you're expecting. And that's going to be a big challenge at a time when there's limited resources for diseases like leprosy. And it's important to remember that as we find more and more cases, that's a real success for the leprosy program. It's not a failure. It's a really important success to find more and more cases, identify them, and understand the burden of disability that has occurred as a consequence of the COVID pandemic. And then as we learn more about those cases, we'll then be able to estimate how many more cases are sitting behind those. But for me, the main message is that we expect to see an upswing in leprosy diagnoses, and that will be a real success of this program.
So that was the only silver lining in your message, that yes, we are able to track, or we are able to get to a point where we see a large number of cases happening, and instead of cringing about it, we should be happy that yes, they are getting out in the open and we'll be able to diagnose.
And that is a difficult message, and the sheer burden of cases is and as you've been highlighting, the fact that they'll be later in their progression of disease is going to be very difficult. So I guess really, we need to think about, as well, you highlighted innovation. So how do we handle that kind of burden or find that burden quickly? And you also highlighted that in your report. So this may be an opportunity for innovation, is another hopeful sign, and also just all of us to keep that focus on neglected tropical diseases, because there's going to be so many health problems coming to light over the next year. So I congratulate you all on your hard work.
Thank you, Professor. I would now move to Dr. Joy Shribu. So Joy, you have been at the forefront of handling NTD programs in Nigeria and Guinea, if I'm not wrong. And you are also a person who is also handling COVID response in Nigeria. Could you take us through, just like what Professor Deodra just said, that there is a huge backlog that we are going to see in the couple of days, in the coming months. What is it that the situation in Africa is, in terms of, if you can focus on Nigeria? So COVID has certainly put brakes on all the detection activities, at least in some parts of my country that I know of. What is it in Nigeria? Has it put brakes? How much is it? And what do you see it's panning out in the coming days?
All right, thank you very much for inviting me as well. And I think Professor Dedri has already put the ball rolling. Just as you have mentioned, Nigeria has also seen a significant negative impact of COVID-19 on the NTD interventions. And this is mainly in terms of access, because most of the persons who are affected by NTD many times rely on the NTD interventions as the basic healthcare support that they get. So, of course, the effects of COVID on livelihood, on education, and I'm glad someone will look at the perspective of disability, because it also had that intersection as well. Persons with disability who also have the NTDs were negatively affected as well. So COVID-19 just came to us as an NTD program and just paralyzed us for a few months, because it wasn't something that we had anticipated, so we had to think about innovative ways of ensuring that persons with NTD were reached, because the way the NTD treatments are set out are in such a way that you can actually predict that elimination of NTDs will happen after specific rounds of treatment. But we had those treatments interrupted. Drug supplies were interrupted because the health system in Nigeria had to kind of reprioritize to be able to face the COVID-19 pandemic. So there wasn't much in terms of human resource or financial resource or even logistic support for other NTDs. So that came with an interruption in the plan. And of course, that consequently will cause a delay in the elimination of NTDs. And in some instances, maybe even promote a some kind of reappearance of some of the NTDs in areas where we thought this had been eliminated. So yes, a delay in elimination, and also a reappearance of some NTDs. So it was a negative thing entirely, unlike the situation with leprosy, where more numbers or more cases will come to the fore. For us in the other NTDs, there was definitely a disruption to the delivery on NTD interventions.
Thank you, Dr. Joy. That tells us that our stories are not different. Our stories are similar. We may be different in terms of geographies, but the impact is kind of similar across all these countries.
Sure.
I'll come back to you, Dr. Joy, and also Deirdre, but I'll move a bit. I'll be more focused, and I'll invite Dr. Nandri Takahiro because Doctor, you have been with the Sasakawa Health Foundation, and your interventions are different nations, different countries. We have heard from Dr. Deodra and Professor Deodra and Dr. Joy that there has been disruptions. So there is no denial of the fact that there has been disruptions, be it medical supply, be it access to care, be it mobilizing resources. So there had been there had been challenges at different layers. Now, what do you see as an organization, is as also a vice chair of GPZL? How do you think that globally we can connect together, learn from these examples? And is there an example or some best practices that you already know that you are working on, that Sasakawa Health Foundation is working on certain best practices to overcome these challenges?
Yeah, thank you very much. So first of all, it is my honor to be able to attend this panel discussion. And as a part of our response to COVID-19 last year, the Sasakawa Health Foundation has launched a new grant scheme to support the community of the persons affected by leprosy amid the pandemic. And we provided around $450,000 to 28 organizations in 14 countries. And let me share what we have learned from this program, because I assume that this lesson could add value to the result of your report. First of all, I think, since Amal is here, he can also add later. But what we have learned is that participation of the persons affected by leprosy is very much crucial, and they should now be positioned not as mere beneficiaries of support, but as actors fully involved in carrying out the related activities. For instance, active participation of the persons affected by leprosy has contributed in the following areas. One, the proper selection of beneficiaries. In order to distribute the limited resources equitably, it is necessary to have an accurate grasp of the living conditions and needs of beneficiaries, and to be fair in selecting the destination of, for instance, emergency relief supplies. The active involvement of the people's organizations of the persons affected by leprosy in this process leads to ensure fairness. And second point is providing the relevant information. At the beginning of the pandemic, we figured out that many persons affected by leprosy did not have sufficient access to the information they need to stay safe and well amid the coronavirus pandemic, including information on how to avoid the infection, government support measures, and treatment of leprosy and its after effects. The people's organization could serve as a communication channel between local governments and community of the persons affected, bridging the information gap and improving access to existing support schemes. And third one is reducing stigma and discrimination. In the areas covered by the activities of the people organizations, their awareness-raising activities have produced results, and there is a relatively little stigma and discrimination toward persons affected by leprosy among the general population. So therefore, expanding the scope of activities of people's organization can be a way to reduce stigma and discrimination.
You have made, thank you for your message, Dr. Takahiro. You have made two very important points. One is getting access to information, which is very important. And second is participation of people affected by leprosy in the schemes, in the programs that are meant to deliver services to them. Thank you. Your points are very duly noted, well noted. I'll come back to you, but before that, I'll ask Amarji from Nepal. I'll take a cue from what Dr. Takahiro said. He mentioned that it is very important for people affected by leprosy to participate in the process. Now, whatever little knowledge I have, there are pockets in Nepal where leprosy is active, and these are slightly resource poor settings. When we talk about leprosy in Nepal, the pockets are resource poor. There are poor people in those settings. do you see these people affected by leprosy, or the associations of people affected by leprosy, empowered enough? They are empowered enough to play the role that we are expecting them to play as agents on the ground who would work for the others who undergoing treatment. I mean to say, see, my question is very specific. There is two dimensions to leprosy and other entities. One is the medical dimension and one is the social dimension. So medical dimension is access to care, access to healthcare, medicine, drugs. The social dimension is you are already starting from a disadvantaged position. Low income security, low food security, low house security. From that stage, how do you expect to empower them or motivate them to be that kind of an agent who could take work in the community and be that facilitator? And how do you participate them in the process?
Thank you so much, Subhajit, for your kind invitation. And thank you again for raising the issues that has made me to go ahead. So, distinguished, esteemed guests, ladies and gentlemen, my dear brothers and sisters who have experienced Hansen's disease from Nepal, India, and other parts of the world. As a person who has experienced Hansen's disease or leprosy, this is my great honor and privilege to take part in this very important webinar panelist as one of the panelists. I would like to thank you all for this privileged position to be part of this celebration today. For me, the biggest lesson COVID-19 has provided is the established meaning of isolation. The sense of isolation, mostly the society-imposed isolation for the people who have experienced Hansen's disease, was known to them. They were the victims of the isolation that the society imposed upon them. After COVID-19, in our community, common people to understand the pains, sufferings, and difficulties of being isolated. They have sensed what it means to be isolated. If there is any positive impact by COVID-19, one of them is the broader understanding of the sense of isolation. As a note of reminder, the people who were experiencing leprosy or Hansen's disease would be isolated to a place where none would be allowed, and the affected would be condemned to the sheer isolation. Now, due to COVID-19, almost everyone knows how painful it is to be isolated and be away from their own family members. I hope anyone in any corner of the world who are experiencing Hansen's disease or leprosy do not have to be isolated, stigmatized, or traumatized in any way. May the Hansen's disease eradicate with its consequences alone. On the note of the challenges by COVID-19 is that the poor and underprivileged, our brothers and sisters around the globe, were victimized more due to the closure of workplaces, market, transportation, and all. In Nepal, only many were in danger of starvation. Thanks to those with golden hearts like Sasakawa Health Foundation, dear Dr. Takahiro Nandri is here in this panel as the panelist, who supported us a lot. And he clearly mentioned how important to support the people's organization at the dire emergency, because we people who have experienced Hansen's disease, we know we are on the ground and we know the people and we know the needs, and that will not help to reach our brothers and sisters with the emergency relief packages, but also that helps us to strengthen our organization also. That's why we have been empowered. So thank you And this is my great honor. And, Mr. Dr. Nandri is with us. And thank you so much, Sasakawa Health Foundation. Not only IDEA Nepal, they supported more than 22 organizations of people. I think more than 22 organizations of people who have experienced Hansen's disease throughout the world. So I think this is very important to support through the organization of people, through the people's organization, because people's organization, we know the grassroots reality. So this is so important. And thanks to those with golden hearts who supported us with the relief that we could distribute throughout all 7 provinces through our selfless IDEA leaders and volunteers. Through IDEA Nepal, we could also support our brothers and sisters who were infected with COVID-19 with cash relief so that they could buy necessary medicine and nutrition foods to protect themselves. Sadly, we lost some of our people due to COVID-19. In addition to this, from the perspective of an organization, we were forced to shift our priorities. We have to skip some of our major projects. This has adversely hindered the overall development, and this is going to take longer time to compensate of what we have lost. In summary, we have had a horrific time during COVID-19, and I feel that as we combat it together, we shall be unified, organized, and well prepared in the days ahead. To emphasize, COVID-19 has helped us know the real sense and the trauma caused by isolation and untouchability. We could also learn that the difficulty can be defeated if we are united. I therefore would like to urge you all to be united to combat the challenges associated with the Hansen's disease as well as other NTDs. Again, thank you so much for the organizer for giving me this wonderful opportunity to share some of the impacts that had happened during COVID-19 situation. Thank you so much. Over to you, Supervisor.
Amarji, I completely hear you loud and clear when you say the isolation and the repercussion of that isolation and trauma. I hear you when you say that. And I also agree with you when you said that giving relief, food aid, financial aid is just a minuscule part of it. But what you have to do is you have to empower that person to be able to be financially independent, to get skilled. And so you give a man a fish, you feed him for a day.
Yeah.
You teach a man how to fish, you feed him every day. So that's the message that you have given to us. And that's very kind of you to say. And I must also admit that you were an inspiration to all of us across the world, and we all learn from you. Thank you. And with that, I would move to Linda. Linda has been waiting for, I'm sorry, Linda, to keep you waiting for so long. But I'll move slightly from the social dimensions of the impact of COVID on leprosy. And I'll talk about a bit of the treatment bit, how we have heard from different panelists how it has disrupted the preventive measures, screening, diagnosis, early screening. Now we talk about zero leprosy. We have a roadmap to follow. We frequently in our conversation, we talk about zero leprosy, and that roadmap actually guides us, our activities and our interventions. So NLR International, I understand it's a consortium and you work with different partners across the world. What are the thoughts that come to your mind when you see these disruptions in the COVID? And mind you, this is just 2 years that we are saying, and touch wood, we don't know what's going to pan out. And for that, I'll come back to Professor Deirdre. I'll bug her sometime later, maybe not in the meeting. But what do you think? What thoughts come to your mind? What are your concerns at this point?
Yeah, thank you, and hello, and thanks for inviting me also today. It's an honor, and I have not been impatient at all because it's very inspiring to listen to all the speakers, and I also recognized a lot in the reports I read. So yes, NLR, No Leprosy Remains, is an international alliance organization. We are active on 4 continents, and we promote and support prevention and treatment of leprosy, prevention of disabilities, social inclusion and prevention of stigma. And we conduct research and develop innovations. And actually, all of these areas obviously were affected by the COVID pandemic. Perhaps, except maybe the last one, the innovation, because we had to innovate a lot. And I also recognize when I listen to the other speakers and the reports that a lot of innovation has also been going on. So our response to the disruption, we're in 4 continents. So obviously the lockdowns and the needs varied a lot in the different waves that we also went through together, and the things that may be coming up. And the effects also really differed. But in general, we had to adjust the contact screening that was going on. The SDR PEP distribution had to be paused due to the physical distancing, but also because of the health workers that were shifting towards the COVID tasks. We had to adjust a lot of protocols, training materials, the standard operating procedures. Logistics had to be adapted and had to be made COVID proof. And then when COVID did allow us to resume, we started contact screening again. We started the skin camps again with all the proper measures. So protection, distancing, hand washing, having specific time slots, and then we could resume. What I also learned is just because we are so rooted in all the communities, we have the trust of the communities, we could start doing the door-to-door outreaches. This was allowed by the way we are rooted in the communities, and it helped to continue the treatment or restart it as quick as possible. I also heard from the previous speakers the importance of providing information to people affected. The people that really needed information about keeping safe from COVID, avoiding fear, but keeping them safe through telephone, through social media, radio. And also later on, we started with all our partners, our alliance partners, to get the people affected by leprosy vaccinated, because there are these underserved groups also in this area. Another important issue was the shortage of the multi-drug treatment. So we collaborated a lot with stakeholders to overcome the out-of-stock situations in several countries, and to at the same time structurally improve supply chains. And all of this, actually all of what I've mentioned, always in close collaboration with governments, with the people affected and their organizations, and with our partners in the different networks. So really, if I think back now 2 years and look ahead, I think innovation has been crucial, partnership has been crucial, and besides all the difficulties and the challenges we've had, we've also been leapfrogging in some areas. I think we've also learned things that will be very useful for the future, and in that sense, I also see some positive outcomes that will support us in the future. As Amal was saying, these diseases, not only the leprosy, but also the NTDs broader, can be defeated if we are united, and a crisis does unite, yes.
Yeah, I completely get it, what you said. And in the first half of your message was some of the keywords that struck me is adaptation, adjustments. Those were the keywords that I think we all are doing in our own way. That reminded me of a proverb I read in one of the NLR articles. It's a proverb from Mozambique. And that proverb says that if the rhythms of the drum beats change, your dance steps have to be adapted to that. So yes, we are adapting, we are changing our dance steps based on how the rhythms are changing. Thank you, Linda. I'll come back to you in a while. I'll also, to give us a really a perspective on the person affected by disability, because we see when we talk about leprosy and NTDs, we cannot talk about them in isolation. We need to figure in the disability component, which is the truth. So to take us through that, I'll invite Dr. Shruti Mahapatra. She is not just the executive director, CEO of Sobiman, but she's also the chairperson of NCPEDP, and she's also a activist and disability rights activist. So I would try to get something optimistic from you, Dr. Mahapatra. I would like to know that when we talk about a person with disability, the dependence on that person of disability on the social capital, which the economists call social capital, friendly neighbors, helpful neighbors, relatives, friends in the community. So that social capital, we feel has been disrupted because of COVID, the social distancing and fear about transmission. So all that assets that they had were disrupted. So how do you think, as an organization, as somebody who is in it, who has his boots on the ground, what do you see are the challenges on that front?
Thank you, Subhajit. Good evening, organizers, co-panelists, and the audience today. I would just like to say you a couple of things before I jump into your question directly. See, in this pandemic, we have become aware of three important things. The one thing is governments across the globe, they are unprepared to address the unique challenges of people with disabilities in emergency situations and humanitarian response. And a glaring example is the sudden lockdown. We did not consider the support system. Right now, you are mentioning the social capital. So we did not consider essentiality, the necessity of the social or the support environment before we clamped a lockdown. The second issue which came to the fore is, to some extent, education, employment, livelihood, all these have been addressed by governments in different countries. But when it comes to health issues, they remain very low priority for the governments. And the third thing which came to the fore during this pandemic and the response to the pandemic is strong voices of people with disabilities. If people with disabilities across the world have been able to survive this challenge, it is because of the local networks that were formed by people with disabilities and their family members. It is because of the local innovations that people did that we were able to survive this pandemic. You were just only yesterday, we had a seminar of about 40 young people in Odisha who are affected by leprosy. And I found that the aspiration and the challenges of youth with affected by leprosy is not much different from the other youth with disabilities. And beyond geographical barriers, across the categories of disabilities, they have the same kind of aspirations and they are facing the same kind of challenges. Health, education, livelihood, all this was impacted. But the most serious area was health and well-being. See, what happens when a family is impacted by COVID-19? The funds go down. In the initial stages, when you're talking about countries like India, where most people are either in the low income, middle income, or the very poor categories. Majority of the people, 90% of them, hardly 7% come in the rich or the financially strong categories. So what happens is when the livelihood got impacted, when the world came to a standstill, money became low. When family budget became low, immediately what was impacted were the first things that were cut off from the family budget were the needs and requirements of those with disabilities. So care and support got reduced. Then therapy, caregivers, food, medicine. I mean, I'm talking about special diets. All this met with a cut. People did not have access because there was no accessibility. People did not have access to very basic things like rehabilitation processes, regular physiotherapy, regular speech therapy, even very basic things like medicine. We all know that a lot of people with disabilities have secondary infections like a lung infection or diabetes, and they could not get their basic medicines. Many spinal cord injured young people who use diapers, who use a lot of catheters, who want to live a very independent life, they were impacted because many of them had some money to buy it, but they had no access. There was no way they could go out and get it. This support system, which got disturbed, it again got repaired. How? It was by local innovations, by people coming together. I remember, I know 21 of our young friends who have done some counseling courses, who have done psychology courses. They came together and they formed a WhatsApp group. And they told us, people who are living in isolation, your young people with disabilities, if they are suffering depression, isolation, mental challenges, anxieties, worries, direct them to us. The first day, there were 7 calls. And within 3 days, the 21 counselors, they started receiving about 30 calls per counselor. So that was how these young group of people came up with this WhatsApp idea, and it clicked. We also know how the spinal cord injured people, they came together, they formed their groups. As there was no access to medicines and catheters, they started calling people and finding out who has extra diapers. Has anyone brought extra leg bags, extra catheters? And slowly it was getting distributed among the different groups. There was no access to food and medicine. In very distant Malkangiri, which is a hilly region, where people live in a very scattered areas, young people got together, they brought in their bicycles, and they were carrying medicines, food supplies, and they were going up the hills through rough terrains, carrying small little ice packs with insulin, with other medication that was needed, and they were distributing it. Health camps. We hear a lot about the digital healthcare and telemedicine, but in very innovative ways in rural areas, people were using their mobile phones and they were transferring messages, they were collecting information, contacting their doctors in their contact list, going back and addressing the need of people with disabilities. Food was getting distributed. I know in my state of Odisha and in many other states in India, food was being distributed, dry ration was getting distributed. But we did not pause to think how a family which is headed by a person with disability, how a family which has 5 orthopedically impaired children, how will they go? What is the mode of transport they will take when entire transport system has come to a standstill? And that's where the local volunteers, the student volunteers, youth with disabilities as volunteers, they were pulling ration, they were visiting households, they were going from house to house and telling them, you have received 35 kilos of rice, can you give me 5 kilos so that I can give it to the person who has not been able to go to the this thing. They were forming small medicine banks. We formed small sanitary napkin banks, small insulin banks, and in a barter system, people were exchanging their daily requirements. So lot of innovations, if you look at it, lot of innovation has come out by the initiative of the disabled people and their family members. Okay. And very interesting, I must tell you this, when therapy could not be addressed, mothers were being trained as barefoot therapists. So here in Bhubaneswar, we have been able to create 21 barefoot therapists who were learning a little. Modules were being developed, physiotherapy and modules were being developed. We were sending this through WhatsApp. And mothers were going home to home and giving therapy to their own child and to similar children in their community. Thank you.
Thank you, Dr. Mohapatra. I must tell you, listening to you is also therapeutic for me. And listening to this story of how the power of collectivism can win over any challenge, that is really, really heartwarming and gladdening for me. I really appreciate you sharing these short stories of how we're overcoming these challenges through the power of collectivism. Thank you again. Thank you so much. I'll come to Dr. Deirdre once more. So Professor, my question to you is, we know what are the causes of disruptions, and we also know what are the impact of disruptions. What impact does disruptions have? Now, when your team, I'm sure you lead the consortium, when you do this projections and you do this analysis, so are you only predicting the risk based on the screening and no diagnosis or treatment, or do you factor in all these socio-economic challenges also, which perhaps aggravates the risk factor as well? And also, if you could also tell us that we have this NTD roadmap in front of us, how can, through these predictions, through these projections, you can help us complement our efforts towards that?
Thank you. Lots of interesting things in that question, so I'll attempt to answer some of them. I know we're limited time. So I think it's really important that, quality of data is really important for neglected tropical diseases. It can be challenging. So we understand that there are economic drivers of infection and also delays in getting diagnosed, but we often don't have the information with which to really pin down the size of that effect. So in terms of doing forward predictions, it's quite challenging using aggregate numbers and things. So, but we can perhaps hypothesize about what those things might do and look at that impact moving forward. In terms of forward projections for leprosy in particular, there aren't that many groups working on it. There are none within our consortium at the moment. So I think it's an area of future research, and something that we're trying to do is support, because we're quite a northern consortium. We do now have a couple of African partners who are really fantastic, and so we are really a European and American consortium. So one of the things that we're actively trying to do is support modelers from countries where these diseases are endemic in doing more modeling and prediction work. So we'd be happy to talk to people who would like to do more on leprosy. And so, I think it's going to be making sure that, as one of these innovations, as scaling up of diagnoses and finding of cases comes forward, that we try and do good data collection, because that's going to be critical in understanding how much more this burden is going to grow, because it's unlikely to be as simple as, twice the number we had 2 years ago. It's going to be twice the number, plus, they're going to have much greater needs, and it's making that economic case. And for me, it's the role of the modelling in helping you make that economic case for the amount of money that's going to be required to support these programmes in a context of very low resources because of the COVID pandemic. So my suggestion would be try and think about data collection alongside all these other things you're trying to do. You're trying to do so much, but if you can get good quality data, it will help the advocacy a lot.
I completely concur with you on this. Even getting data, granularity of the data is a challenge in some parts of the world. If you see, I understand, and that's a huge barrier to what you do in achieving what you're trying to achieve. I completely understand, and I think what I really appreciate what you and your team is trying to do. Evidence, even if it is based on a hypothesis, at least leads us to somewhere. At least it gives us a time to prepare and plan for the next interventions. And we can customize our interventions based on those evidences. Thank you. Thank you. Dr. Joy, I would come to you and ask you a hypothetical question. And that is, For example, we have run out of ideas. We as a country, as in India, we have run out of ideas on how do we take this NTD elimination program forward. What would be your one of the main suggestions, as from your own example, from your own experience? What would you suggest that we should do to continue this NTD elimination program activities despite the COVID risk?
Thank you very much. That's a very difficult question to answer in a short time. But what I would start with would be to say, a lot of work has gone into NTD elimination, especially I know in India and other parts of the world where we're grappling with NTDs, and the tendency to be discouraged, especially when we have disruptions like COVID-19 is there. But first, I would suggest that, as a country, for all the critical stakeholders to come together and just kind of review so far what has been done and all the successes, that have been achieved in terms of eliminating NTDs, and then to kind of find a way of scientifically deriving how much work needs to be done in the NTD landscape to get us to elimination, and then getting together the political will, and then also working with other partners to raise the essential funding. What we find will be most useful at, especially as we reach this tail end, is to come up with innovations. And one of the things that we have done as a country with the support of site savers is to develop a risk assessment and mitigation action plan, because we realize that today we're dealing with COVID-19. We don't know what we may be dealing with subsequently. And so it's important for programs to ensure that we mitigate against the potentials of any kind of disruption, whether it is from a pandemic, or natural disasters, such that our programs can stand strong even in the midst of such challenges, because that's the only thing that can get us across to the finish line. I believe that we are able to combat NTDs and eliminate if we unite, because there are lots of factors, that come into play. There's funding, there's research, there's data, there's a lot that we need to do. But if we unite and are able to get all the stakeholders in the room, I believe that as a country in India, there's hope that you will reach the elimination line. So.
Thank you so much for answering to my hypothetical question. You've answered it very well, Dr. Joy. And I think, yes, risk assessment and mitigation is the key. I completely, we're on the same page on that. Thank you so much, Dr. Joy. And I'll move to Dr. Nandri Takahiro. You heard, Dr. Takahiro, you have heard from Linda. She said that for her, for NLR International, what has worked is innovation and collaborations. Now, you are, I think you are a vice chair of GPZL, which is also a partnership of, it's a consortium of leprosy-focused organizations. What has worked for you in terms of, if you think about global collaborations huddling together, brainstorming and taking the actions?
Yeah, thank you very much. I especially agree on the point made by Dr. Joy, which is the importance of uniting among the stakeholders. So let me take an example of the Global Partnership for Zero Leprosy. As you know, the GPZL is a platform for organizations and individuals aiming to achieve zero leprosy, zero disease, zero disabilities, zero discrimination, with major players in the leprosy community participating in the platform. The COVID-19 pandemic has caused serious disruptions, as many panelists have said, to diagnosis, treatment, rehabilitations in various parts of the world, and measures against the disease have been dealt a setback. With that in mind, it is very important that we make the best use of GPZL, a platform in which a wide range of actors participate in order to realize zero leprosy. I would expect that GPZL could effectively mobilize the diversity and strengths of its members, since GPZL is a flat platform in which everybody can participate. I expect that GPZL could create an environment and a framework in which members can play strategic roles by taking advantage of their respective strengths in various areas, such as project implementation, research, policy making, fundraising, and advocacy. So GBZL could make effort to create a global movement by reaching out to government officials and having zero leprosy placed on the political agenda. In particular, I think it is very much important for all the stakeholders to come together in solidarity to achieve the common goal of zero leprosy. So when we stand united all together, we can have a big impact.
Yes, I hear you loud and clear. It's again a message of collectivism and coming together. Thank you, Dr. Takahiro. Linda, I'll come to you. You have very categorically touched upon the importance of collaboration and innovations. Just I mentioned on that. Could you give us an example of an initiative that comes on top of your mind that you think has really worked, not just for one member of NLR, but it has been replicated or has a scope for replicating in other countries as well, or non-NLR or the larger NTD and leprosy community? Any one initiative that you think should be replicated or has a scope for replication? If we think about the zero leprosy goal, zero transmission, zero disability, and that goal we have in mind.
Yeah, definitely a couple. Obviously, we already spoke quite a bit about our the great impulse that COVID has been to leapfrog to digital solutions. So a lot of the training, education, information sharing can be done so effectively. Also, self-care can be done so effectively through virtual means. I mean, even us here now, like today, we would not all have been able to be here with the cost of travel and the time of travel. So virtual possibilities for training, learning, education, they provide an inclusiveness that is very helpful. It's very efficient, but also privacy, which is sometimes important for disease-related issues. So this is not rocket technology. We've all experienced this, but a very specific development within NLR that we've shared between the countries is making more use of the telephone. In Brazil, we did telephone surveys. They were done to understand the needs of the people affected by leprosy, but also how their mental health issues were developing. We were providing COVID information through the phone. Also in India, linking the people affected to the health systems and processes. This was already replicated, and this can definitely be replicated more. I was thinking when Dr. Shruti was speaking, in India, we were also very successful empowering, I think, 150 adolescents as change makers who motivated residents of the leprosy colonies to get vaccinated. So, yeah, in general, as I said, a crisis, it really creates solutions and innovation. Technical, not high tech, low tech, really, but also in the collaboration. As I mentioned earlier, around this topic of stock outages, not only for leprosy, but also for other NTDs. In times of crisis, you have to do teamwork, and the structural changes that came out of that, I think also learn us to replicate and to work together for structural changes in the future.
I'm really glad to know about the change makers in India. I was not aware, but you'll be also glad to know that we at the Leprosy Mission Trust India, we also have this concept of change agents. We have something called WACA, which is Women as Change Agents. So we identify women from the grassroots who are affected by leprosy and other disabilities. We empower them, we sensitize them, and we encourage them to do the same thing and empower the others. So it's a chain reaction that we try to achieve with those women champions. That's a fantastic initiative. Thank you so much for letting us know about this. And thankfully, I'm just told that Mr. Arman Ali, who has managed to, who was little unwell, is still unwell, but he has managed to make some time for us and join this conversation. Arman, thank you so much for joining despite not keeping well. And could you please, I'm sure he would not like to harp too much because Dr. Mohapatra has already said given her perspective on people affected by disabilities. But I would like you to know that I would like you to tell us the question of accessibility. It has been a key phrase for the entire 2020 and 2021 for the people with disabilities. Accessibility, it's not just about getting access to medicines or access to treatment, but it's also about access to getting essential stuff to survive, to live by. Now, Dr. Mahapatra had spoken some of the community-based, community-driven initiatives that people in Orissa and other states took to mitigate that crisis, that gap. What has been your reading? Especially, I am sure NCPD has come up with that report on the impact of COVID on people with disabilities. If you can also share some of the findings that comes on top of your mind.
Thank you so much, Subhajit, and all the panelists have kind of spoken what is need to be said. I must reiterate the fact that disability remains an afterthought, and this is it's a global phenomena which we had already we knew it, but this has come bluntly on our face in midst of this pandemic. When we talk about accessibility, Subhajit, and the report that NCPDP did, locked down and left behind, it was the report which we did during the first lockdown, which was declared in 2020. The fact that all the orders and SOPs and guidelines issued by the government of India in particularly, I can speak, was not in accessible format for people with disabilities. People who are blind, or people who are deaf, or people who were with mental health issues. And as I said, it's an afterthought, despite the fact that the Department of Empowerment for Persons with Disabilities, under the Ministry of Social Justice and Empowerment, Government of India, had issued an excellent guidelines for the state governments to implement. It was completely looked over and it was not taken into consideration. I think for on the day of the leprosy, the World Leprosy Day, we must acknowledge the fact that one of the most marginalized people in this world would be people who are affected with leprosy, and the stigma which they come with is something which cuts across all disabilities. There's a multiple level of gatekeeping. There's multiple level of discrimination in which we have to call out and name. It's very important that we look at disability as a development and a human rights issue, and not as a charity and a welfare. It is our right to get access to quality health services, quality education, and the ability to move with our freedom wherever we want to. And this is not coming to us in any kind of welfare or a ticket which you get out of pity. This is our right. And I think the groups of youth with disabilities or youth affected with leprosy, which has been constant effort by DPI and DPI India in particular, and NCPDP to collaborate and work in collaboration, in synergy with the government of India, with the other civil society organizations, private sector, and create a larger awareness about the facts and remove the myths. Imagine a person who is affected by leprosy not been treated for any other health ailment because of the status of their leprosy being affected by leprosy. I mean, in this time of the world, can you even dream of this kind of discrimination? I mean, I will not even get into problems around denial of education or denial of housing. These are something which is very fundamental and also a state specific subject. So I think accessibility remains a core, because without accessibility, you cannot get access to education, you cannot get access to health, you cannot get access to information, and that includes access to justice. I think on this World Leprosy Day, we must, collaborate and ask all the difficult questions to the right authorities, to the people, so that we ensure that no one is left behind.
Thank you, Arman. Taking a cue from what you said, asking difficult questions. So one of our audience has asked a somewhat difficult question. And that question, if anybody would like to comment on that. And her question is, her name is Sophia, and her question is, we talk about access, we talk about a decent quality of life for people affected by leprosy and other disabilities. Now, is there enough advocacy? Is there any adequate talk or discourse on access to decent living conditions, decent spaces? Has there been any initiative that we have taken to talk about decent living conditions, decent housing, and decent access to decent spaces for people affected by leprosy and other disabilities? Would any of the panelists likely to take this question?
Can I go first, and then other panelists can come in? No, at DPI India, we have formed a core group of organizations, experts, which includes legal luminaries, to come together to work on various issues around discriminations against people affected by leprosy. One of their initiatives was to strike down various laws and legislations which was discriminating against people affected, and which were struck down by orders. And there are other issues which is taken up from time to time. There are some good precedents set up by some state, where the state department has allotted housing to people affected by leprosy and so on. But there's a lot that is need to be done. As I said when I started my point, that the stigma which is within the community has to go away first. First, we need to value ourselves. We need to accept who we are and do not hide behind some disguise. I think that's the first thing. I am a person with disability myself, so I cannot hide my wheelchair and go in and meet somebody pretending that I have a temporary medical issue, because that's my identity. And I think it's very important for everybody who has a disability or a condition which is to do with the leprosy, must accept and fight that discrimination, and not hide out and not live in denial. And until and unless we do that ourselves, nobody else is going to come and do it for you. Thank you, Subhajit.
Very, very valid point. There's no point in hiding and under the garb of being disabled. Another question, while we have been discussing about pandemic, which is certainly a contingency, I think we'll take this last question because we are running out of time. So we'll take this last question, which talks about somebody called, I'm not sure who this person's name is, but his or her question is very clear, that how do the panelists see the impact of climate change on the people affected by leprosy, and how do they think that it is going to affect what is the way forward to adapt and mitigate the impact of climate change on people affected by leprosy? Would anyone like to comment on that question, respond to that question?
Well, I can say a few words, although this is not an area we are focusing on specifically, but I think climate change will be another crisis that will show where the world health systems are vulnerable and overburdened. And also it will be another topic, another challenge to all of us that will hit the vulnerable people the hardest. There will be so many consequences of insecurity and changing climate systems that will affect health. But again, it is always the most vulnerable people and the most vulnerable health systems that will be affected most. So it's another area where we've been speaking about disaster preparedness and doing different types of surveys or preparedness reviews that we should definitely be doing, and again in collaboration, working together to understand what we are moving towards and how we can overcome that with different stakeholders and different partners with different expertise.
Absolutely, absolutely. Also, from whatever little, Dr. Takahiro and Amar, would you like to comment on that question?
Yes, I think the point made by Linda is correct. Given that the community of the persons affected by leprosy belong to one of the most vulnerable communities. So I think we really need to incorporate the issues on the climate change when we think of the the leprosy services. I think this is very much the important question. That this is something we have been missing. So I think we should definitely consider when we think about the future activities related to leprosy.
And to add to what Linda and you have said, I'd say when we think of this pandemic and climate change, when you think of climate change in particular, we must consider the destruction it causes to the existing infrastructure, the health infrastructure. That's where we have to really, really focus on. But that's another discussion that would entail another conversation. But on that note, I would thank all of you very, very much for taking out time on a Sunday afternoon, Sunday morning, Sunday evening, and spending an hour and a half with us and sharing your thoughts and insights with us. I really, really am grateful, and please express my gratitude on behalf of the Leprosy Mission, DPI International, NCPDP, and Sasakawa Health Foundation. Thank you so much for joining, and thanks once again. And we expect you to have as a future panelist in our future conversations. And we will, I promise you that we will keep this takeaways, we'll document these takeaways, and will, as an organization, as somebody representing advocacy and communications, we will try to pick up on those points and start working with whatever limited means and resources we have at our disposal. Thank you so much. And if you can, but I would not mind you guys staying back for the short film festival if you have time. I won't hold you for long. It's a 10-15 minutes festival. But anyways, if you want to log out, you are more than welcome. And thank you once again. And thank you. And on that note, we move to our last segment of today's virtual event, which is the Short Film Festival. And this is going to be equally exciting, trust me. And the title of our Short Film Festival is Through the Lens of Human Dignity. As you all know, this World Leprosy Day 2022, the theme is Being United for Dignity. So all these films I will show 3 categories of films to you. These films are nothing but compelling stories of how common people with leprosy and disabilities are rising above their adversities, are overcoming their challenges and trying to live a life of dignity with a little bit of handholding and support from the organizations. So I would request Ms. Tina Mendes. She is the head of Sustainable Livelihood and Community Empowerment at the Leprosy Mission Trust India, to introduce the film festival and the theme of the film festival to our audience. Over to you, Tina.
Thank you, Subhajit. Hello, everyone. It's indeed an honor to be introducing a human dignity as the theme for today. We all know how human dignity is central to the core of human life. But also we are aware how for several people affected by leprosy, living a life of dignity can often be very, very challenging. We at the Leprosy Mission Trust India, through our community-based interventions, have actually worked with individuals and their families affected by leprosy and the communities that they live in. We worked across several sectors, and we are still working across the sectors, such as health, education, livelihoods, socio-political empowerment, to name a few. And I mean, in the area of health, we have tried to help individuals affected by leprosy better manage their disability. We've done this by bringing physiotherapy, occupational therapy, assessments for corrective surgeries, customized aids and appliances closer to their homes. Subhajit mentioned about the mobile therapy unit, which in itself was a boon and an innovation during the time of lockdown, because it enabled many individuals affected by leprosy to be able to manage their disabilities. In the area of livelihoods, we have helped build entrepreneurs by designing and promoting and skilling individuals affected by leprosy in enterprises that are viable and sustainable in rural environments. Besides, we also work with organizations of people affected by leprosy and other disabilities and communities at large. I mean, the idea is that those affected by leprosy can be heard, can be seen, I mean, can be listened to, and most importantly, can be treated fairly in these organizations and in the communities that they live in. I mean, for us, the Leprosy Mission Trust India, human rights and dignity go hand in hand. And that is the crux of all our programs. I mean, I am sure that the films that will be screened in a short time will depict our humble efforts in our work with individuals and communities affected by leprosy, and how we have facilitated those affected by leprosy be recognized or be included and be part of the communities they live in and enjoy their lives as you and I would. So happy viewing and thank you. Over to you, Subhajit.
வாழ்வாதாரம் ரொம்ப பாதிக்கப்பட்டது. ரொம்ப எங்களால் எந்த வேலை வித்தியும் போக முடியல. எனக்கு இந்த தொழுநோய் சம்மந்தப்பட்ட இது வந்து பார்த்தாங்க, மேடம் ஜான்சி மேடம் வந்து பார்த்தாங்க. அப்புறம் வந்த பிறகு அப்புறம் எனக்கு 2 மாடு கொடுத்தாங்க. அந்த மாட்டை வாங்கி வச்சுக்கின்னு நான் அப்படியே நிர்வாகம் பண்ணினே வந்தேன். இது இப்போ ஒரு மாட்டுக்கு 4 மாடு ஆகிடுது. அதை வச்சுன்னு எங்கள் ஜீவனத்தை ஓட்டின்னு இருக்கோம்.
Dairy is one among the livelihood promoted by Inclusive Empowerment Project here, and the dairy is very prominent and commercial and very profitable enterprise people picks up. They are landless and they fall below poverty line, and they need of livelihood sources to earn some money for their living.
வேண்டிய இடத்துல எங்களை விருத்தாச்சலம் நெய்வேலி பண்ருட்டி இங்கெல்லாம் இட்டுன்னு போனாங்க, ட்ரைனிங் கொடுத்தாங்க. மாடு எப்படி வளர்க்கணும், என்ன செய்யணும், எப்படி என்ன பண்ணணும், பாலக்காரங்க என்ன செய்யணும்.
We have been supporting now more than 250 households affected by leprosy. I also invite supporters to give such as support for the needed households to scale up and also to expand the activities at present happening in Cuddalore district.
எல்லாரும் என்னை போலவே இருக்கணும், என்னை போலவே வளர்ந்து அவங்க போய் அவங்கக்கிட்ட நாடி அவங்கக்கிட்ட உதவி கேட்டு வாங்கி அவங்களும் நம்மளை போல் முன்னுக்கு வரணும், அவ்வளோதான்.
When we say inclusive empowerment, it's not just about skills promotions. This project basically looking at the socio-economic implications of people affected by leprosy and disabilities and women marginalized due to poverty and gender.
எங்கள் வீட்டு எனக்கு 2 பசங்க இருக்காங்க. எங்கள் வீட்டுக்காரர் அப்படி என்னை விட்டுட்டு போயிட்டு ஒரு 5 வருஷம் ஆச்சு. ஒரு லேடி இட்டுன்னு போயிட்டாங்க. எனக்கு எப்படி சாப்பிட்றதுல ரொம்ப கஷ்டமாக இருந்தது. அப்புறம் ஒருத்தவங்க தெரிஞ்சவங்க ஒருத்தவங்க சொன்னாங்க, டிஎல்எம் நிறுவனம் ஒன்று இருக்குது, அது ஊனமுற்றவங்க உதவுறாங்க, கணவரால் கைவிடப்பட்டவங்களுக்கு உதவுறாங்கன்னு சொன்னாங்க. அதே மூலமாக நாங்கள் ஒரு 6 பேர் எங்களுக்கு ஒரு பாக்கு மாட்டை வச்சு ஒரு கம்பெனி செஞ்சு தரோமான்னு சொன்னாங்க. ஃபஸ்ட்டு பாக்கு மாட்டை எடுத்துன்னு வந்து எப்படி செய்யணும்னு ட்ரைனிங் கொடுத்தாங்க.
Making a areca leaf plate which is quite natural and a good replacement for the plastics and then eco-friendly.
சரி, இயற்கையாக செஞ்சாக்கா அது வந்து மக்கர பொருள்னு சொல்லிட்டு அதை எடுத்து செய்யலாம் முடிவு பண்ணோம். வெளியில் கேட்டாலும் கொடுப்போம், மொத்தமாகவும் கொடுப்போம். அதே மெட்ராஸ் சென்னைக்கும் ஏற்றுவாங்க. இப்போ மாதம் கொடுத்தாங்கன்னா நான் ஒரு குழு பணம் எடுக்கிறேன், அதை அடைக்கிறதுக்கு கஷ்டமாக இருந்து அதை கொடுப்பேன். அதேமாதிரி என் பிள்ளைங்களுக்கு வந்து ஸ்கூல் ஃபீஸ் கட்டுறதுக்கு, ஸ்கூலில் நோட்டு புக்கு கேட்பாங்க, அதை வாங்கி கொடுக்கறதுக்கு. அப்புறம் எங்கள் சாப்பாடு செலவுக்கு தினசரி நாங்கள் வாழறதுக்கு மிஷின் இருக்குது, தூள் ஆகிற மிஷின் இருக்குது, அதுவும் வாங்கி கொடுத்தாங்க. எங்கள் டிஎல்எம் நிறுவனம் வாங்கி கொடுத்தாங்க. அதில் போய்ட்டு போட்டால் பொடி ஆக்கிடும். அதுக்கப்புறம் மண்புழு உருவத்துக்கு அந்த உரத்துக்காக நாங்கள் யூஸ் பண்ணிப்போம். அது மூலியமாகவும் நிறைய பேர் அங்கே வேலை செஞ்சிட்ருக்காங்க.
Still there are households who deserve to receive these kind of support from the leprosy mission. They are waiting for the support to come to their doorstep and to make a better change in their lives.
மரியாதையோட வாழறோம், சமூகத்தில் எங்களுக்கு நல்ல பேர் இருக்குது, அது இருந்தால் போதும் சார் வாழ.
POID camp is Prevention of Impairment and Disability camp. We organize these camps along with the government so that we can sensitize the duty bearers on the need of these aids and appliances and the customized footwear, etc.
POID கேம்ப் செல்ஃப் கேர் குரூப்பில் நாங்களும் கவர்மெண்ட்டும் அதில் நிறைய விஷயம் செஞ்சாலும் டிஎல்எம் குரூப்புக்காரங்க நிறைய விஷயங்களை என்னுடைய இதில் அனுபவத்தில் நிறையா அவங்க தான் சார் நிறைய செய்கிறாங்க.
Our district level leprosy DD and the leprosy mission. So both combined, they have given us training on leprosy, which is very important as at field level for early identification, intervention and preventing the deformity.
எங்கள்கிட்ட இருக்குது அந்த இதெல்லாம் செய்கிறோம் போகிறோம். பட் அது இன்னும் கொஞ்சம் ஆக்டிவாக செய்கிற விஷயத்தை அவங்கள நான் நிறையா பார்த்துருக்குறேன். அவங்களோட நான் இணைஞ்சு நிறைய விஷயம் செஞ்சேன். POID கேம்பில் நான் நிறைய செஞ்சுருக்கேன் சார். அது இந்த 18 கேஸ் கண்டுபிடிக்கிறதுக்கான இது வந்து டிஎல்எம் இவங்க தான். ஏன்னு கேட்டால் அவங்க வந்து எங்களுக்கு ப்ரொவிஷன் இது கொடுத்தாங்க. இந்த ஒரு 20 பேரை நபரை தேர்ந்தெடுத்து அவங்களுக்கு பயிற்சி கொடுத்து அவங்கள இறக்கி தான் சர்வே பண்ணோம். அதில் எங்களுக்கு ஒரு 15 கேஸ்க்கு மேலே கிடச்சிது.
now the governments in other districts, they are calling us for our sharing our expertise for their mobile POID camps. So we are doing it even beyond our project areas, and if we have more facilities, then we can reach many people.
Lata is a young girl, lives in Salayambalam. She is interested in getting involved in making candles.
இந்திய தொடுநோய் சேவை அறக்கட்டளை அது மூலியமாக எங்கள் கிராமத்து சாலையம்பலத்தில் வந்து பார்த்தாங்க. பெரிய ஒரு டீமு போட்டாங்க. அப்போ வந்து எங்கள் அந்த குழு அமைச்சு 12 பேர் அதில் நாங்கள் சேர்ந்து அது மூலிமா எங்களுக்கு ஒரு வாழ்வாதாரத்தை ஏற்படுத்தி தரேன்னு சொன்னாங்க. வேணான்னு சொல்லிட்டேன் நான். அதுக்கப்புறம் நான் மெழுகு செய்கிறேன்னு சொன்னோம். 12 பேர் நாங்கள் சேர்ந்தோம், ஒரு குழு அமைச்சோம். அப்போ வந்து நாங்கள் சிறு தொழில் சேருன்னு கேட்டோம். எல்லாமே கொடுத்தாங்க, பயிற்சி கொடுத்தாங்க. அந்த பயிற்சியை நாங்கள் அதில் எல்லாமே நாங்கள் கற்றுக்கிட்டோம். 12 பேரும் கற்றுக்கிட்டோம். மெழுகு சேருன்னு சொன்னால் அப்படி எங்களுக்கு வாங்கிட்டு வந்து மெட்டீரியல் எல்லாருமே
She has 12 more community members who are also people with other type of disabilities. These people with the disabilities come together as a producers, and they received required skills and got equipped and capacitated.
ப்ரொடியூசர் கம்பெனி வந்து இதை வந்து எடுத்துக்கிட்டு இது எங்களுக்கு வந்து விற்று கொடுக்குறாங்க. கொடுத்து அது மூலயமா எங்களுக்கு நல்ல ஒரு வருமானம் கிடைக்குது. வருமானம் கிடைக்குது. இந்த சமுதாயத்திலையும் இந்த உலகத்திலையும் எங்களுக்கு நல்ல ஒரு மரியாதை மதிப்பு இருக்குது. அது மூலமா எங்களுக்கு நல்ல ஒரு தேவைகள் எல்லாமே அது மூலமா எங்களுக்கு நல்ல ஒரு
பையனுக்கு கால் தூக்க முடியாது சார். சப்படாங்களை போட்டும் உட்கார மாட்டான். ரெண்டாவது இந்த காலை வந்து கீழே இந்த காலால் தாங்கி தான் தூக்கி அப்புறமா மேலே தூக்குவான் சார். எங்களுக்கெல்லாம் வசதி இல்லைங்க சார். நான் வந்து அவனை ஹாஸ்பிட்டலில் கொண்டு காட்டுறதுக்கு அவங்க அப்பா 5வது படிக்கும்போதே போயிட்டாப்பல விட்டுட்டு.
All these people with locomotor disabilities, so they have to travel so many distances to avail the services. Also, they have to pay more money. We have set up a unit with all the facilities of physiotherapy equipments and the occupational therapy equipments in the village level.
The children with disabilities, when they come, we assess them and we see their needs, functional needs, and we train them. We teach the exercises to the parents so that the parents will come together daily at the therapy unit and they do the therapy for their children.
அப்புறம் ஆனால் இங்கே வந்த பிறகு இந்த ஃபிசியோதெரப்பி செஞ்ச பிறகு என் பையனுக்கு இப்போ பரவாயில்ல சார். எனக்கே சந்தோஷமாக இருக்குது. அவனுக்கு வந்து காலும் நல்லா தூக்கி இதுங்கிறான். அதே போல் சப்படங்களை போட்டு இப்போ கொஞ்சம் உக்காடுறான், கொஞ்சம் நடக்கிறான் நல்லா. அது வந்து எனக்கு ரொம்ப சந்தோஷமாக இருக்குது சார்.
If we make this village level therapy at all the blocks of the whole state, then it will definitely help the people to overcome their difficulties and it will make them functionally independent. I am very sure about it.
This is the first in kind in India that a people organization, a farmer producer organization is been established and promoted and run and managed by the people affected by leprosy and disabilities themselves.
நாங்கள் வந்து 503 பேர் மொத்த உறுப்பினர்கள், ஒவ்வொருத்தரும் ஒரு பங்குதாரர்கள். இதை இணைஞ்சு இதில் வந்து 11 பேர் நாங்கள் டைரக்டர் இயக்குனராக இருக்கிறோம். அந்த இயக்குனரில் வந்து மாற்றுத்திறனாளி, தொழில்நோயால் பாதிக்கப்பட்டவங்க, விதவை மற்றும் வறுமை கோட்டுக்கு கீழே உள்ளவங்க, இதில் 10 பேர் இயக்குனராக இருக்கிறோம்.
They looks at majorly the two factors. One is the technical part of it, the skill promotions, the training needs, and the financial support and the marketing needs especially, and how this business will continue and provide the economic support and the social acceptance in the society.
பங்களிப்புனா அவங்க தான் சார் முழு பங்களிப்பு எங்களுக்கு. இப்போ என்னென்னா ஆரம்பத்துலேருந்தே எங்களுக்கு யாருன்னு நாங்கள் என்னன்னே தெரியாத இருந்த சமயத்தில் டிஎல்எம் வந்து எங்களை தேர்ந்தெடுத்து அவங்க வந்து எங்களுக்கு போதுமான பேச்சு திறனோ மற்ற தொழில் சம்மந்தப்பட்ட பயிற்சியோ எல்லாமே கொடுத்து வெளி உலகத்துக்கு தெரியப்படுத்துறது டிஎல்எம் தான். என்ன பலன்னா அவங்க வந்து இப்போ தேவையான பொருள் உற்பத்தி எங்கெங்கே அணுகணும், எப்படி பேங்கில் பேசணும், அதுக்கு என்ன செய்யணும், அது பயிர்களை அதிகமாக மகசூல் பண்ணி செலவு பண்ணி ரசாயன உரங்களை போட்டு தயார் பண்ணால் லாபங்கள் ஒன்றும் இல்லை அப்படிங்கிற மாதிரி இருக்கிறதுனால இப்போ எங்களை சார்ந்து தொழு உரம், இந்த மண்புழு உரம் இது மாதிரி தயார் பண்ணி இதில் செலவினை குறைச்சி அவங்க மகசூல் அதிகப்படுத்தி நல்ல வருமானத்தை பெறுவதற்காக அவங்களுக்கு ஒரு வாய்ப்பு கொடுக்கும். அப்படின்னா இதில் கற்பூரம், கம்ப்யூட்டர் சாம்பிராணி, அப்பளம், ஊதுபத்தி, மெழுகுவத்தி, பாக்கு மட்டை, தட்டு இது பண்ணிகிட்ருக்காங்க, பால் வியாபாரம் பண்ணிகிட்ருக்காங்க. மேற்கொண்டு நாங்கள் இன்னும் இருக்க முன்னேற்றங்கள் அடையணும். அதுக்கான என்ன எதை தேடி போடணும், எப்படி பண்ணினால் நாங்கள் வருமானத்தை ஈட்டி பெருக்கலாம் அப்படிங்கிறதுக்காக இது பண்ணுறோம். பேங்கை சார்ந்து மற்ற முதலீடு பண்ணி ஒரு தொழிலை உருவாக்குறதுக்கு முதலீடு வேணுங்கிறதுனால எதிர்பார்த்துக்கிட்டு இருக்கோம் சார்.
So it's all about overcoming the limitations pertinent to the economic factors and social factors around. Definitely there's a tremendous effort is still required, to handhold is required to continue the services which are being envisaged.
Thank you team for playing this series of films. Before we move on to the second segment of films, I'm joined by filmmaker, the man behind those films, Satyajit Sharma. We had a nice time filming all these compelling stories in Tamil Nadu for over a week or so. And I thought it's fitting. It is only fitting to invite him and request him to say a few words about what were his thoughts when he shot those films and what went into making those films and his own experience. Satyajit, if you can.
Yeah. Thank you, Subhajit, for introducing me to this, to the people who watch the films. And it was the first the film festival on the live platform over Zoom. So I think officially we haven't released it yet on any website or anywhere. This was the first place where it got played. So the first, when we spoke about this film, the best part was I was excited about to hear is that we are going to shoot it in Tamil Nadu. So the first thought what came to my mind was the location. Yeah, the subject was definitely given to us from TLM office, and there were 3 specified points that I recall. The film was all about the livelihood management, livelihood generation, disability management, and the advocacy. We always discussed about this, that this has to come in our films. Secondly, I mean, my thought was going around how do we build the stories around this. So we had a couple of mail exchanges. You gave us the explanation, the detail about it, and I discussed it with our team, with my team, the cinematographer, that we are going to shoot it in Tamil Nadu. So we'll have to make use of the location. That is very important. If we get into the story, the location won't be like coming on the film. So how do we established. So for any filmmaking, there are some thumb rules that we do take care of. There is always plans. There's always plans. Like for any filmmaking, it's only plan, plan, and plan. So it's basically pre-production when we get the subject to know ki kya karna hai and what we are going to shoot and what are the stories. And then we get into production, and then this is the post-production part. In the mixing of all these thoughts together, we'll have to tell the story that is important in any filmmaking. And this was a documentary film, non-fiction film. So I remember very well, I was, every time I used to insist, Subhajit, that we need to create the script for all these 6 films, because there are small subtopics like candle making, areca, plate making. So, but somehow we were not getting into the scripting thing. So it got little delayed. But the good part was I didn't reveal it to Subhajit. But in non-fiction, the best part is even we shoot the films, if we shoot all the visuals, we can develop a wonderful script. And this happens in a documentary or non-fiction filmmaking. Fiction that is not possible, because we'll have to write all the dialogues and everything in fiction filmmaking. So the storyline was there. We made use of the location, the temples, the beaches. We took early sunrise shots. Of course, the main key subjects was definitely there. That was in the room or in a hall or in a certain location. But we need to think about the whole target audience who are going to watch these films. So we need to think it on a bigger canvas. Like the audience could be
Satyajit,
yeah.
If I may interrupt you.
Yeah, please.
So it is slightly getting into a master class on video editing and film
I will
editing.
I will cut it.
And so I will request you for a master class on film editing next. I know you are very much engrossed in your work, and you are very, very honest to your profession. And when we all really admire you for what you do, you are a masterful storyteller, and we have all seen a glimpse of that through those films. So I really, really appreciate and acknowledge your efforts. Thank you so much.
Thank you so much. So let's cut it short. So we took the story and we mixed it so well with the audio and video, making use of the sound effects as well, the ambience. So story had to come out, and the livelihood generation and what was that? Advocacy and the other topic. What was that, Subhajit?
Livelihood generation and disability management.
That's disability management. That's had to come out. So we weaved our audio video around that, and I think we came out with all 6 short stories out of this. So that's all about about the 6 films. Thank you, Subhajit.
Thank you so much, Satyajit, for taking out time and coming.
Thank you, sir.
Yeah. So friends will now move on to the next segment. But before that, I would like to urge upon you to consider that these films that you're going to see, these messages that you're going to see in the next 2 categories, don't judge them by their technicalities, don't judge them by the quality of the resolution, but judge them with the intent with which they were made, the messages that they're trying to say. And the next segment is the jury's choice. We conducted a competition, short film competition, and based on whatever we received, this is the film that you're going to see. It's a single film that you're going to see has been selected as the best film on the jury's choice. So can we request the team to play this video, following which I would request the members of the film to join me for a short, very, very short conversation.
என்னடா உங்களுக்கு வேலை போறீங்க, என்னையும் கொஞ்சம் விட்டுருங்க. இந்த கையும் காலையும் இழுத்துக்கிட்டு வந்து ஸ்கூலுக்கு வந்து என்னடா பண்ண போற? போய் பேசாம வீட்டுக்கு போடா. படிச்சு பெரிய கலெக்டர் ஆக போறியா?
பள்ளி குடியரசு தின விழாவிற்கு சிறப்பு விருந்தினராக வருகை புரிந்திருக்கும் நம் மாவட்ட ஆட்சியர் அவர்களை வருக வருக என வரவேற்கிறோம்.
அனைவருக்கும் வணக்கம். முதற்கண் கடவுளுக்கும் என்னை ஈன்றெடுத்த தாய் தந்தைக்கும் என் நண்பனுக்கும் நன்றி சொல்ல கடமைப்பட்டிருக்கிறேன். இந்த மேடையில் நான் சிறப்பு விருந்தினராக வந்திருக்கிறதுக்கு முக்கியமான காரணம் என்னவென்றால் என் நண்பன் தான். பள்ளி படிக்கும்போது மாற்றுத்திறனாளியாக இருந்தபோது கேலியும் கிண்டலுமா, நீலாம் பள்ளிக்கூடம் போய் என்ன சாதிக்க போகிற, உனக்கு என்ன, நீ பள்ளிக்கூடம் படித்து என்ன வேலை வாங்க போகிறன்னு கேட்டாங்க. அப்போது எனக்கு உறுதுணையும் பக்கபலமும் இருந்தது என் நண்பன். இந்த மாவட்ட ஆட்சியர் அளவுக்கு உயர்ந்ததுக்கு காரணம் என்னுடைய நண்பனுடைய உறுதுணையும் ஒத்துழைப்பும் தான் காரணம். இந்த விழா மேடையில் என் நண்பனை அறிமுகப்படுத்த பெருமைப்படுகிறேன். இவர்தான் என் நண்பன். இவர் இல்லை என்றால் நான் இந்த இடத்தில் இல்லை.
சார், எனக்கும் இதுமாரி தட்டி கொடுக்கவும் ஊக்கப்படுத்தவும் ஃப்ரெண்ட்ஸ் இல்லாமல் போயிட்டாங்களே, இருந்தும் தான் ரொம்ப நல்லா இருந்திருக்கும்.
You're on mute.
Thank you, team, for screening this film. We really like the message behind this film, which talks about putting aside all biases and prejudices and be of each other's help and think of each other on equal footing. So that was a larger message to me, and I would request Mani Ivanan and his team to join me for a very, very short conversation. And we want to also appreciate them. Oh yes, we have Mani and his team here, Mani, Raja, and where are those kids who were there in the films? Oh, brilliant, brilliant. So these were all aspiring budding film actors that you saw just in the film. We wanted to take this opportunity to thank each one of you for thinking through this and making this possible and delivering a very, very powerful message. We thank you so much, Mani.
Thank you.
If you just kindly a word or two on what was the thought, how did you execute it, what was the thought behind, and who was the storyteller, who wrote the story, whose idea was it?
Thank you so much for this opportunity. Yeah, the entire story is this is Mr. Raja's story. So he came with this idea, and because all these people are getting therapy services from our roommates and all, so that they are also very interested. So Raja came up with this idea, and so he identified the actors, and once he told them the stories, and I think the film is done by written to us, the complete acting, editing, and everything. I think,
Brilliant. Thank you so much, Mani, for joining us. Thank you so much for the film. Thank you. And with that, we move on to the final, absolutely penultimate stage, a final section of Film Festival, which is more of interviews, some messages from the grassroots people across 3-4 states. And I want the team to show those films to us.
कुष्ठ रोग होने पर मुझसे लोग जो थे वो तरह तरह की भेदभाव उत्पन्न करते थे कि इनके साथ उठना, बैठना, खाना, पानी, छूत, जैसे मैंने बर्तन छू लिया तो उसको न छूने देना, इस प्रकार की भावनाओं मैं कुष्ठ पीड़ित रोग का व्यक्ति हूँ। कुष्ठ रोग होने पर मुझसे लोग जो थे वो तरह तरह की भेदभाव उत्पन्न करते थे कि इनके साथ उठना बैठना खाना पानी छूत, जैसे मैंने बर्तन छू लिया तो उसको न छूने देना, इस प्रकार की भावनाओं से मुझे देखते थे। मैंने समाज में जब इसका इलाज करना शुरू किया तो डॉक्टर साहब से जानकारी मिली कि ये रोग एक प्रकार से छुआछूत से नहीं फैलता है, ये रोग एक प्रकार से बैक्टीरिया होती है। अब मैं पूर्ण रूप से ठीक हूँ, समाज मुझे मान सम्मान देती है। भाइयों से मैं निवेदन करना चाहता हूँ कि कुष्ठ रोग पीड़ित व्यक्ति को उनके साथ भेदभाव की भावना न रखें।
बोला एक समय मतलब कुष्ठ वाला बीमारी हो रही से, फिर मैं गोली दवा खा के हॉस्पिटल जाके गया हूँ, इलाज कराएं, फिर मैं बढ़िया से ठीक हो गया हूँ। अब अभी मैं चूड़ी के धंधा करता हूँ अपन गांव में समाज में बढ़िया से। हाँ, अगला ले भी समझाथन कि कोई मेरे दाग धब्बा होते तो हॉस्पिटल जाके दिखावा, अच्छा हो जा, ऐसे करके बताथन भी। और मैं अच्छा से हाँ, मैं घर परिवार अपन समाज सब में बढ़िया से हमें और मोर धंधा भी अच्छा चलते, मतलब कोई मतलब ये नहीं करे। पहले शुरू में थोड़ा सा डर लगी, बीमारी हो गई करके मैं बहुत डरे, फिर गोली दवा खाए इलाज चलीस तब मोर डर पूरा भाग गई।
It's painful to see people denied to get married as one of the family members is affected with leprosy. Even today, few of my graduates affected with leprosy face challenges to get a life partner. Whom to blame? As society, policymakers, faith-based organizations, government, NGO, and the list goes on. I remember my initial days in TLM, say around 2005. I won a first prize in a competition held among the staff with the theme, The World Without Leprosy. I stated it's not possible due to the lack of vaccine, lack of awareness, and most importantly, are we ready to accept a person affected by leprosy to a family or into a dining table? It took 7 long years for me to get married, working in the leprosy mission. I believe each and every one of us stand responsible for this change. I am a part of a change. What about you?
मेरे हिसाब से डिग्निटी का मतलब है शक्ति और रिस्पेक्ट का मतलब है सम्मान, और मुझे लग रहा है डिग्निटी इज इक्वल टू रेस्पेक्ट। रेस्पेक्ट का सही मतलब है मान्यता, सत्कार, सम्मान या प्रतिष्ठा। देयर इज ए लाइन व्हिच इज मोस्ट फेमस इन आवर कंट्री, treat others the way we wish to be treated. If I want to be respected, it is very important that I also give respect other person. Which type of respect I want from the society? I want from the society good respect, good attitude and good behavior.
என்னோடய ஒர்க் வந்து ஃபோட்டோகிராஃபி. எங்கேயும் வெளியில் போக முடியாது, எந்த ஃபேமிலி ஃபங்க்ஷனுக்கும் போக முடியாது, ரொம்ப கஷ்டப்படுவேன். டெய்லியும் காலையிலையும் மத்தியானமும் ட்ரெஸ்ஸிங் பண்ணுற வேலையாக இருக்கும், அதாலே ரொம்ப மன உளைச்சலுக்கு ஆளாயிருக்கேன். ஆனால் இப்போ வந்து அந்த 2 வருஷத்துக்கு முன்னாடி ஒரு ஆப்ரேஷன் பண்ணி காலில் உள்ள விரல்லாம் கட் பண்ணி ரிமூவ் பண்ணிவிட்டு பிளாஸ்டிக் கால் வந்து ஃபிட் பண்ணி இப்போ நல்லா நடக்கிறேன், போகிறேன். நான் இப்போ ஃபோட்டோகிராஃபி ஒர்க்குக்கு போகும்போது ரொம்ப ஈஸியாகவும் இருக்குது, கம்ஃபர்டபுளாகவும் இருக்குது. இன்னி வரைக்கும் யாரும் என்னோடய ப்ராப்ளத்தை கண்டுபிடிக்கவே முடியல. இதுக்கு எல்லாமே வந்து முழுக்க சப்போர்ட் வந்து இந்த டிஎல்எம். செகண்ட் ஆஃப் ஆல், நான் இன்றைக்கி வந்து கடலூர் மாவட்ட இளைஞர் அணி தலைவராக இருக்கேன். சென்னையில் உள்ள இந்த டிசம்பர் 3 இயக்கத்திலோட ஒரு மாநில உறுப்பினராகவும் இருக்கேன். நாங்கள் மற்ற மாற்றுத்திறனாளியும் இதேமாதிரி நாங்கள் எங்களை மாதிரி கஷ்டப்படுற அத்தனை மாற்றுத்திறனாளியும் கண்டுபிடிச்சி கடனிலே இல்லை உள்ள மாற்றுத்திறனாளியும் நல்ல நிலைமைக்கு வரணுங்கிறது தான் எங்களோட நோக்கமே. அந்த நோக்கத்தை ஃபாலோ பண்ணி நாங்கள் வந்து இது வரைக்கும் எல்லா மாற்றுத்திறனாளியும் எங்களுக்கு தெரிஞ்ச அத்தனை மாற்றுத்திறனாளிக்கும் வந்து 2016 சட்ட அமைப்புகளை பற்றி சொல்லிக் கொடுத்து அவங்கள வந்து நம்மளோட உரிமைகளை பெற்றெடுக்கிறது தான் எங்களோட வேலையாக இருக்குது. நம்ம வந்து கை ஏந்திர இடத்துக்கு கூட கை கொடுக்குற இடத்துக்கு வரணும்னு சொல்லி 5% இடஒதுக்கீடு கேட்டிருக்கோம் தேர்தல் எலெக்ஷனில். அந்த இடஒதுக்கீடுக்காக போராட்டம் பண்ணி இப்போ நாங்கள் வந்து அதை சக்ஸஸ்ஃபுல் பண்ணியிருக்கோம். விழுப்புரம் டிஸ்ட்ரிக்டில் வந்து நாங்கள் வந்து 47 மாற்றுத்திறனாளி எலெக்ஷனில் நின்று அதில் 22 பேர் கிட்டத்தட்ட ஜெயிச்சிருக்காங்க. இதுவே எங்களோட மிகப்பெரிய வெற்றியாக நாங்கள் நினைக்கிறோம்.
कुष्ठ रोग मुझे 7 साल पहले हुआ जब मैं 10th क्लास में थी। तब मैंने पास की हॉस्पिटल में दिखलाया और वहाँ से एमडीटी मेडिसिन लिया और आज मैं पूरी तरीके से स्वस्थ हूँ। कुष्ठ रोग होने के बाद बहुत सारी चुनौतियों का सामना करना पड़ता है। स्कूल में, घर में, समाज में, समुदाय में बहुत सारी दिक्कतों का सामना करना पड़ता है और एक महिला होने के साथ उसकी जो चुनौतियाँ होती हैं वो दुगनी हो जाती हैं। और ऐसा नहीं है कि जो कुष्ठ रोग से प्रभावित लोग होते हैं उनको कम अधिकार होता है, उनको भी उतना ही अधिकार होता है जितना आम इंसान को होता है। परिवार में रहने का अधिकार, समाज में रहने का अधिकार। और ऐसा भी नहीं है कि कुष्ठ रोग से प्रभावित लोगों को उनके बीमारी की वजह से जाना जाए, उनकी दिव्यांगता की वजह से जाना जाए। ये ज़रूरी है कि उनको उनके पढ़ाई की वजह से जाना जाए, शिक्षा की वजह से जाना जाए, उनके नाम की वजह से जाना जाए और उनकी काम की वजह से जाना जाए।
विकलांग लोगों के सम्मान और हक की बात करता हूँ। विकलांग लोगों को हर क्षेत्र के अंदर जैसे शिक्षा हो, आरोग्य हो और शिक्षा हो, आरोग्य हो, रोजगार हो, इसके अंदर उनको एक सम्मानपूर्वक वागणूक मिले। हर परिवार में उनकी बात सुनी जाए, समाज के अंदर उनकी बात सुनी जाए, उनको एक सम्मान मिले ताकि वो अपने अंदर एक सम्मान महसूस कर सके। रोजगार क्षेत्र में उनकी पढ़ाई के अनुसार उनको एक रोजगार मिले ताकि वो अपना एक अच्छा जीवन व्यतीत कर सके। अपना दूसरे जो विकलांग लोग होंगे वो विकलांग लोगों को भी उससे एक प्रेरणा मिलेंगी और वो विकलांग लोग अपने अंदर एक आत्मसम्मान महसूस कर सकेंगे।
मुझे आज से 25 साल पहले कुष्ठ रोग हुआ था। इसकी दवा एमडीटी मैंने खाया और अब मैं पूरी तरह से स्वस्थ और ठीक हूँ। आज भी हमारे समुदाय में कुष्ठ रोग की वजह से भेदभाव का सामना करना पड़ता है, जिससे उनके मान और सम्मान पर ठेस पहुँचता है। लेकिन हमारे भारतीय कानून में सभी को सम्मान से जीने का अधिकार है। हमारा ये मानना है कुष्ठ से प्रभावित व्यक्ति की पहचान उसके नाम और काम से होनी चाहिए, न कि उसकी बीमारी से।
Should I go ahead? Okay, so as we come to the finale of the day today, we are so pleased to see that the World Leprosy Day and the World Neglected Tropical Disease is providing a platform for raising awareness to various initiatives globally and nationally. And we really hope that this movement will gain a lot of traction and provide strong commitment and collaboration to beat leprosy and NTDs for good and for all. I especially thank all the participants who took out time today. We had a long session today, and I know there have been so many events and so many programs, but despite that, everybody has taken out time to come. I'm immensely thankful to all our speakers who took out time from the very, very busy schedule and some at very odd hours to take out time for this virtual event. Thank you so much for sharing and articulating your challenges and experiences so wonderfully. And I certainly believe that as we work together, we can reach our targets well in time. I would especially like to thank Dr. Anil Kumar, Amir, Linda, Joy, Jedri, Dr. Nanri, Arman, Dr. Stuti, Dr. Premal, Tina, and Satyajit for joining us today. We're really, really honored by your presence. I especially need to mention my deepest sense of appreciation to all those who partnered with us, especially Sasakawa Health Foundation, NCPDP, DPI, and the WEEK for their support to the program. It's very important that such discussions continue, take place regularly for awareness building and also to ensure that the policy conversations around policy and advocacy are there globally, especially in India. Thank you so much, each one of you, for your support. I especially want to thank everybody who sent their entries for the film competition, for a special mention to all our program managers, all our VTC principals who had very short time and yet they kind of motivated by Tina and they sent in fabulous responses and we got so many films and it was very difficult to choose which to play and which not to play. So the jury had a very tough time. So that brings me to thank the jury for helping us select that very film and also the voices from the field which were aired today. I thought I'm going to save this name for the last, but I can't move ahead without mentioning his name, and that is Shubhoji, my colleague, organizer, the moderator for today, the marketer, the digital marketer, the coordinator, and the dozens of hats he's worn. And he's been wearing despite of the fact that he has just recovered from COVID. I also extend my heartfelt thanks to all the team members of the partnering organization for their enormous cooperation, especially in the last week, to make this virtual event a fabulous one and a great success. Thank you so much, Ashish, Sumit, Mahima, and Muskan from NCPDP and DPI. And thank you so much, Amit, from the week for, the late night calls and decision making. Thank you so much for being there. I especially want to thank the sign language interpreters, Preeti and Manisha Singh, and the Hindi and the English language interpreters, Bharat, Nupur, and Anandita Rao. As you see that we have a beautiful hall today. We had a lovely entrance. It took a long time to understand how to go about creating it. Thank you so much, Ashish and our team, for all your help in connecting us to Kamal and Trigger Digital. So thank you so much, Kamal, Simran, and Ravinder. And I also especially want to thank DPI and NCPDP team for all their help, Aman and Dr. Shruti for their leadership, and especially to TLMTI Trust senior management team, especially Dr. Premal and George Abraham for completely believing in us and trusting us with this event. So thank you each and everyone for coming to this event. I am really grateful for your presence and we look forward to connecting with each one of you soon. Thank you so much.